It's a patient who's around 39 years old, has two children already, and had prior stress urinary incontinence, was seeing pelvic floor therapy, was going to pelvic therapy for that, had complete resolution of her stress urinary incontinence, was keeping up with her exercises, but then she had a new baby. She got pregnant again at 39, had a new baby, and it was like all her symptoms came back. Everyone was like the floodgates open. She had to wear a diaper. She could not hold her urine. And so she was very overwhelmed. She also owns her own business, three children, full-time job. And so this is a woman who's not sleeping well, sex drive is gone, she's leaking urine and having to wear a diaper. She's even when she is sexually active with her husband, it's dry because she's also nursing. Just a lot of issues. She was just miserable. And so for this patient, the treatment plan I had for that when she was done nursing, well, while she was nursing, was pelvic floor therapy. So she was working with a pelvic floor therapist to help regain muscular tissue. And in between those treatments, she will come for the laser vaginal rejuvenation. So there were concurrent treatments, pelvic floor therapy and laser. And with after the pelvic therapy is usually 12 weeks, the laser treatment is also once a month. So by the 12th week for 3 months. So by the 12th week period, her symptoms were completely resolved. She regained control of her bladder. Sexual experience was much, much better. And for the other symptoms she was experiencing of low sex drive, I was able to help her when she was done nursing with hormone therapy. So I gave her hormone replacement bioidentical testosterone to help with sex drive. And if sex drive is high in women, they can also lubricate on their own. So they can stimulate the new glands that we just put in the vagina with the laser and get more lubrication. And so this lady was just, I would say, transformed by the treatment plan. She got hormones for her system and her sex drive. She got pelvic floor therapy to strengthen her muscles and laser to optimize that pelvic floor therapy. And she was a new woman by 3 months, 3 months later. All right. So Heather came to me and asked, oh, well, she sent an email asking about the laser vaginal rejuvenation because you guys are getting requests about it or patients are asking you about it. Can you tell me more a little bit about that?
Yeah, I had a specific patient who, I guess her gynecologist recommended this specifically, and gave her all the paperwork. And she had this lovely packet of stuff that came in. And she goes, "What do you guys know about this?" And we went, "Nothing."
Yeah.
So, basically, how it happened.
Yeah.
And so we started to do a little bit of just research online. And we found a lot of really good studies and things on just general laser therapy, red light therapy, but none referencing this. And so when Heather found out, she was like, "Oh, I can get that for you." And we were like, "Sweet."
All right, perfect. Thank you for spending your afternoon with me. Morning. I'll try not to keep you too long. I learned about this treatment from one of my colleagues, actually, who has a med spa. And, she had an open house, and I went to the open house and I thought, laser therapy, what could this be for? And so I looked into it. I was with a hospital-based practice at that time, so that was not common. So regular OBGYNs don't necessarily provide this as an option. Most people do it at a med spa. It has a bad rep in getting the title of vaginal tightening. So people don't ask their doctors about it. People go to spas and, places where they get their waxes done and ask about things like that. So med spa incorporates the knowledge of a physician with, medical knowledge as well as aesthetics to try to get the woman where she needs to be. And then we find that a lot of women who are having vaginal issues, it's not really for tightening, it's for actually pelvic floor and atrophy symptoms. And so that's how it fits well into gynecology, at least for me. So when I started my own private practice, I certainly wanted an opportunity to offer that to my patients. So I went in search of it and had this went to a conference. They, doctors who were currently using the machine talked to me about it. And so I decided to invest in it. And it's been, I would say, fulfilling to have it as an option for my patients because their results are so instant, so dramatic. So, okay, let me just get into the PowerPoint. Um, so I'm talking about laser vaginal rejuvenation today, and I'm going to focus on three categories: the genital urinary symptoms of menopause, stress urinary incontinence, and sexual dysfunction. And pelvic floor therapy was my number one treatment option for my patients with this. Let's say there is a patient who has genital urinary syndrome of menopause, which includes, I'll go here, vaginal atrophy. Mostly, everything feels dry. They talk about a sandpaper feeling, friction during intercourse that makes it unbearable to have sex with their partners. They have urinary symptoms, so they're going to the bathroom all the time. When they before they leave wherever before they leave home, they go to the bathroom. When they get to where they're going, they go to the bathroom. Before they leave where they're going to go back home, they go to the bathroom. And sometimes they're not emptying a ton, they're emptying just a little bit, but there's just this sensation that they have to pee all the time. And then there are patients who have just burning. They think it's a yeast infection. They're coming multiple times for yeast infection symptoms. It's just itching on the inside, or just a pain on the inside, or just a burning on the inside. So we categorize all those symptoms as genital urinary syndrome of menopause because the underlying cause of it is loss of estrogen within the vagina. And I have some data here. It used to be atrophic vaginitis, vulvovaginal atrophy, urogenital atrophy, because it involves the bladder. The bladder is in that area and has estrogen receptors as well. So as women lose estrogen in menopause, the bladder starts to become sort of acting overactive. And it's a chronic progressive symptom. It's not going to get better. Women always say, well, am I going to have to deal with this forever? Yes, because your body's not going to keep making estrogen forever. So once it gets to that point where the ovaries are kind of done with estrogen, the body starts to react to loss of estrogen. The vagina is the urogenital area is very sensitive to the loss of estrogen. Um, and it can happen in premenopausal women. So there are women who are still having periods, but the body is going to prioritize periods over everything else. So they might still be having periods, but there is a decline in estrogen level. And so they're starting to notice that urinary frequency and urgency, recurrent urinary tract infections, or even vaginal dryness during intercourse. And so about 15% of premenopausal women, but perimenopausal women will present with these symptoms. About half of postmenopausal women will present with these symptoms. And because women are living longer now, we anticipate the population will be about greater than age 65 by 2030. And so this is going to be a continuous problem. Clinicians are going to see more of this. Pelvic floor therapists are going to see more of this because, like I said, when I was with a private group, this was, aside from hormones, this was my second other option for my patients with these symptoms. Um, I just kind of went over this. So perimenopause and menopause, egg decline as women age, kind of starts around age 35, because I do see some young women with these symptoms, 38-year-olds, 39-year-olds. Local effects in the genital area of loss of estrogen. It's underdiagnosed because people are ashamed to talk about it. And so if the doctor begins the conversation, or US physical therapists begin the conversation, then women are more likely to open up about it. How I get people to open up is a questionnaire. They just come into the office for an annual. I give them a questionnaire, and so it emboldens them to actually talk about it. Some people have already talked to their PCPs about it, and the PCP just says, "Oh, it's just menopause, or you're just getting older," and they so some way they feel like, okay, maybe it's not important, maybe I don't need to bring it up, and so the provider, the clinician, starting the conversation will embolden the patient to talk about it. These symptoms can be debilitating. A lot of women talk about, I had a video up on my YouTube page, and somebody commented that her partner left her because of this, which is a legitimate, concern, because they're losing intimate relationships with their partners, and they're constantly uncomfortable. Women who have meetings, constantly having to leave their meetings to go to the bathroom, it's kind of very disruptive. Some people don't travel far because they need to be near a bathroom. So very debilitating to quality of life. So it's pretty significant effect. And then I'll focus on stress urinary incontinence. As you guys know, I want to assume that you see a ton of these. This is my go-to for women who have leaking of urine with stress on their abdomen, coughing, sneezing, jumping, lifting. Risk factors, I'm sure you know, you ladies know, pregnancy, even women who had C-sections. Just because they were pregnant, they had this pressure for almost a year on their pelvic floor. Those muscles do get the brunt of it. Vaginal birth, especially if they have to use vacuum or forceps, really weakens that pelvic floor. There are women who've never had children and they come to me and say they haven't had, they've never been pregnant before, had vaginal births, but they're having incontinence. So I ask other questions. Is there constant pressure, constant bearing down, chronic constipation, or obesity? I'm not constipated, but they have a BMI of 40 or a BMI greater than 30. That's constant lower abdominal pressure on the pelvic floor. And there are just some people that have muscular dysfunction that leads to pelvic floor dysfunction. And so stress urinary incontinence also very, very common. 40% of women, especially women who've had children, it makes them ashamed, brings down low self-esteem. Women are wearing diapers or pull-ups. I mean, they're like, I'm just 40. Why am I wearing pull-ups? I'm not that old. So it can lead to social isolation. I had a patient that said, I don't smell like urine anymore. I mean, just remarkable how it affects women's, you know, life and things like that. And then sexual health, if sex is painful, the woman is not going to be interested in being sexually active. Well, some women will come to me and say, oh, I don't even care about it anymore. It doesn't matter to me anymore. I don't need it anymore because it's no longer enjoyable. The relationship has broken down with their partner. They're not interested in finding a new partner. Most women who regain this part of their life after treatment, they're like, oh, I'm ready to date again because they feel good about themselves again. They're no longer ashamed and feeling like something is wrong with them. Um, most women who are no longer feeling like they're interested in sex, hormones are the biggest thing. They lose sex drive. So for most women, sexual desire leads to lubrication within the vagina, leads to all the stimulation within the vagina. But as we know, sex for women is mental. And so if they have a lot of kids, they have a full-time job, they still have to take care of the home, sex is the last thing on their minds. And so stress of life also tends to add to, and I'm sure do a lot of therapy, like not just physical therapy, you do a lot of like behavioral therapy with every patient you see because you get to talk to them and they share the things that they're going through. So, as physical pelvic floor physical therapists who are dealing with women's pelvic floor issues, I'm sure you get to explore that part of their lives as well. And so, for the genital urinary symptoms of menopause, we have medications. Women are using lubricants for sex. In some ways it's not as desirable. They complain that the mood is lost by the time they try to get a lubricant. There's DHEA. I have a lot of colleagues who don't do laser or anything who use DHEA that very effective. Also, pelvic floor therapy. In most cases, I combine pelvic floor therapy with my treatments, and then vaginal estrogen is one of the biggest. Is my number one, followed by pelvic floor therapy, followed by laser. I usually give my patients three options. I say these are my top tier treatment options. Vaginal estrogen first because it's immediate. You can use it right now. It helps to rebuild the vaginal tissue because the underlying cause is loss of estrogen. So we give the genital urinary area estrogen back, pelvic floor therapy to build up those muscles, bring back strength and lubrication. So that's my go-to. And then for the stress urinary incontinence, pelvic floor therapy definitely the muscles are stretched out, the muscles have been traumatized. Goal is to bulk up the muscles again, lift up that bladder again. And for women who have significant symptoms, prior treatment options were surgery. So they'll have to have mesh to try to kind of pull up that bladder, and this has to be done by a urogynecologist. I know some gynecologists that do it, but you need special training to do this. So I don't do mesh, and I end up giving them a referral again, and they get frustrated that I don't want to see another doctor. I want you to fix this for me. And so that's where my laser vaginal rejuvenation came in. I actually strongly went for this because of my patients who have a history of breast cancer who are afraid of hormones. So for genital symptoms, vaginal dryness symptoms, leaking symptoms, urgency symptoms, I gave vaginal estrogen liberally. But I had a group of patients who did not want to risk estrogen, who had gone through breast cancer, treatment of breast cancer. They're even on tamoxifen, which is to antagonize estrogen in their body so the breast cancer doesn't come back. And those men have significant genital urinary symptoms. And so I was looking for an alternative to estrogen to help those women get their vaginal symptoms back, vaginal health back, I should say. Oh, I apologize. Did I lose my screen? Did I stop sharing? No. Okay, perfect. Let me go back to the PowerPoint. So I made this video to kind of show you the machine, to show you how it's used. I hope it plays. Can you see it on your end? The Femilift machine. Can you hear it and see it on your end?
Yep.
Okay, perfect. So I'll let it play. CO2 laser for vaginal atrophy. People have been asking me how it works, so we're going to create a video to show you guys how it works. It's for women who have vaginal dryness, urinary incontinence, frequent bladder infections, frequent urinary tract infections, frequent vaginal infections, and cannot use estrogen. So this is our alternative for them.
So she is preparing the probe for the magic machine. Well, we can call it the time machine.
Time machine, yeah.
Yep. Yep.
This is the probe. It's an ultrasound probe. It looks like an ultrasound probe, rather. So no needles. You don't need any anesthesia. We just put this inside the vagina, set our settings on the machine, press a foot pedal, and get a beep. And then we turn it, foot pedal, beep. Turn it, beep. Turn it, 360. Okay? And then we pull back 1 centimeter, press the foot pedal again. And then we turn it all around 360. So we keep coming out 1 centimeter, turning around 360 until the vaginal canal is treated. Okay? And that's it. It's like 5 minutes. That's the whole treatment. Yeah. And we're offering it at Dardur Gynecology. So come on in. All right, so that's my little promo video for my for the vaginal laser. So what this laser is doing is causing what we call microscopic injuries. So after a treatment, I actually put a speculum in the vagina. I can see the little dots areas where the laser beam was, applied to the vaginal tissue. And so the body is responding to that laser treatment in terms of repair. So it's sending macrophages, sending all the repair mechanisms to repair that part of the vagina. And so that's how we get collagen, new tissue, and this is CO2 laser. So it's CO2 that it's using, and it's basically inducing a repair mechanism of the body. So the body is going to repair that vaginal area at the cellular level, causing collagen and elastin synthesis, resulting in thicker vaginal epithelium and glycogen-rich cells. So new glands are coming in, so they get their lubrication back without even having to use a lubricant. The collagen makes the vaginal tissue thicker, so it's not easily bruised during intercourse, or it's not it's not thin. The epithelium is not thin. They're not bleeding after sex because everything is so thin and dry. Also, because of collagen and thicker tissue, it lifts up the bladder. So that's how it helps with stress urinary incontinence, is that it helps the bladder to be, it helps the pelvic floor muscles to be stronger, so the bladder can hold up, but the sphincter can hold up when there's external pressure abdominally. And so that's how I explain it to my patients, is that this treatment is causing the body to repair itself, causing the body to think, oh, there's an injury over here, let me go repair it. In that way, giving you younger vaginal tissue, thicker vaginal tissue, that helps to strengthen the pelvic floor, glands that give you lubrication. And with that, the bladder also is lubricated and you're not having that urgency feeling. Most of the time, stress urinary incontinence in my experience, I would say anecdotally, my patients, 95% of patients have complete resolution of stress urinary incontinence because of the thicker vaginal tissue, because of the collagen deposits that are being made in that tissue. The urgency symptoms, I usually add additional estrogen. So I add estrogen for that, and I add pelvic floor therapy for that to help with the urgency symptom. And some lifestyle changes. I tell them, citrus, lemons, tomatoes, Caffeine can cause overactive bladder. So urgency is a bit more complex. And so we include lifestyle, estrogen, pelvic floor therapy, and laser to try to get urgency resolved. So the laser treatment lasts about 2 years. A lot of women 2 years later still have resolution of their stress urinary incontinence, still have resolution of the urinary urgency and atrophy symptoms. Um, and after that, because we keep aging, right, the body continues to age, they might just need once a year treatment. The treatment is 3 treatments 1 month apart. So 3 treatments 1 month apart. After that, maybe once a year, and in 2 to 3 years after that. And also because of repair, because of new glands, new nerves, there's increased sexual satisfaction. That was actually something that was a sort of a finding that the initial treatment wasn't used for. The initial treatment was for lubrication and for atrophy, but people will come back and say sex is more pleasurable. They have improved vaginal tone. They just have a better sexual experience. And also the urgency with the overactive bladder. Oh,
Can I
this
ask a
is,
question?
sorry, go ahead.
It looked like earlier, actually, I think 2 slides ago, you made a comment on vaginal infections. Has
Mm,
this actually been proven helpful with like recurrent
recurrent?
yeast and UTI infections and stuff like that?
Absolutely. The underlying cause of recurrent UTIs, recurrent yeast infection, um, recurrent, that's what this normal flora here is referring to, is a pH imbalance in the vagina. And so when there's dryness, women cannot maintain their vaginal flora. When there's less loss of estrogen, women cannot maintain their flora, the vaginal flora. The bladder is also irritable. The bladder has estrogen receptors, so it's also irritable. So what this guy is doing is restoring the normal vaginal flora because now you have lubrication. You have new glands, new tissue, healthier mucosa. And so women are able to maintain vaginal flora, so less yeast infections, and the bladder is also lubricated, so less urinary tract infections, less urgency. Because there's dryness, bacteria will hang around more, especially women who have UTIs after sex. If there's dryness, if there's use of lubricants, so you're using your hands, easier to transfer bacteria, easier for bacteria to sit around in the urethra and then infect the bladder, but more lubrication helps those things to flush out. Does that answer your question?
Yeah, thank you.
Okay. And so before I move on to any other treatments that I offer, I wanted to see if you had any questions at all about the laser. For most of my patients, I actually want to go to this particular patient here. It's a patient who's around 39 years old, has 2 children already, and had prior stress urinary incontinence, was seeing pelvic floor therapy, was going to pelvic therapy for that, had complete resolution of her stress urinary incontinence, was keeping up with her exercises, but then she had a new baby. She got pregnant again at 39, had a new baby, and it was like all her symptoms came back. Every was like the floodgates open. She had to wear a diaper. She could not hold her urine. And so she was very overwhelmed. She also owns her own business, 3 children, full-time job. And so this is a woman who's not sleeping well, sex drive is gone, she's leaking urine and having to wear a diaper. She's even when she is sexually active with her husband, it's dry because she's also nursing. Just a lot of issues. She was just miserable. And so for this patient, the treatment plan I had for that when she was done nursing, well, while she was nursing, was pelvic floor therapy. So she was working with a pelvic floor therapist to help regain muscular tissue. And in between those treatments, she will come for the laser vaginal rejuvenation. So there were concurrent treatments, pelvic floor therapy and laser. And with after the pelvic therapy is usually 12 weeks, the laser treatment is also once a month. So by the 12th week for 3 months. So by the 12th week period, her symptoms were completely resolved. She regained control of her bladder. Sexual experience was much, much better. And for the other symptoms she was experiencing of low sex drive, I was able to help her when she was done nursing with hormone therapy. So I gave her hormone replacement bioidentical testosterone to help with sex drive. And if sex drive is high in women, they can also lubricate on their own. So they can stimulate the new glands that we just put in the vagina with the laser and get more lubrication. And so this lady was just, I would say, transformed by the treatment plan. She got hormones for her system and her sex drive. She got pelvic floor therapy to strengthen her muscles and laser to optimize that pelvic floor therapy. And she was a new woman by 3 months, 3 months later. And so I usually combine, especially for patients with severe stress urinary incontinence, I don't do laser alone. I cannot promise them that laser will give them complete resolution. And so I tend to first have them do pelvic therapy to get a bit of improvement in their symptoms and then add laser, or I do it concurrently so they can be done by the 12th week period. Questions on the laser before I move on to any other treatment that I do offer in my office?
I'm assuming that this treatment is cash based.
It is. It is not covered by insurance. Like I said at the beginning, it got the bad rep of being for just vaginal tightening, but we know it goes beyond that. It's I would say remodeling of the of the genital urinary tissue, which goes beyond just improved tone in the vagina, which is the vaginal tightening part. It goes to health of the vagina, quality of life of the woman. So it is quite pricey depending on which area women are in. Um, in the med spas and stuff, it could be a couple thousands. In our office, we try to do payment plans for women or care credit, however it is for that women are able to bundle the payments to pay for it. But you are correct. The short answer is no, it's not covered by insurance. I give you the long answer.
And do you guys have any data that talks about only one treatment instead of three for women who can't afford all three, but like in
Right.
conjunction with PT and something like this once or something like that? Do you have any data on that or?
I have anecdotal data. I don't have, a control trial or, case study or something. One treatment does not last you the 12 to 24 months. Now, one treatment in combination with pelvic floor therapy might get you there, but the I would say the con with pelvic floor therapy is if for some reason you are not continuing your exercises, then your symptoms will recur. And so a lot of women tend to need to be intentional and to be very present to continue their exercises. I don't have someone with one treatment in PT, so I don't have that data. But one treatment alone with the laser is not sufficient. You might get results for about 3 to 6 months, but symptoms usually return after that. Any other questions I can answer?
Would it be like the same? I'm sure there's slightly different types of machines, but whether people are getting it in a doctor's office or in a med spa, are there actual like differences between that or just that oversight of the physician?
Yeah, great question. So, there's Mona Lisa out there, there's Thermiva, there's Femilift. As long as it is a CO2 laser, I think Mona Lisa is CO2, I think Thermiva is CO2. I'm not completely certain, don't quote me on that. As long as it is a CO2 laser, we know that it is doing the microablative work in the tissue at the cellular level. Those will work, as long as, and some people will space it out. They'll come 2 months later for their second treatment or 3 months later. And so it's hard to get that compounding effect on the tissue sequentially. And so those women are the ones that I find that I'm not getting the same results as the women who are on top of it monthly, not going 3 months or 6 months before they come back for their next one, because then it's like we're starting over. We need that compounding effect monthly, sequentially, to get that repair going and those tissues stimulated accordingly. Any other questions? All right. And so for my perimenopausal women, they're showing up because sex drive has gone away. So women are not, it's not in menopause that they're first showing up. A lot of women are showing up because they don't have sex drive and now it's starting to get dry. Or they're showing up because they're still having periods, but are having hot flashes. They can't sleep. Maybe they had a history of depression and the depression seems to be worsening and everyone around them is asking, what's wrong with you? Are you okay? You've changed. And, they can't concentrate at work. And so what I offer for those, like I said, they come in for their regular visit, I have them fill out a questionnaire because maybe those symptoms have been dismissed. Maybe they're taking something over the counter to help with it, but things are okay. Things are not spectacular. So I usually talk about hormone replacement with my patients. My standard is testosterone replacement, mostly because, estrogen has gotten a bad rep. Nobody wants to do estrogen because of the fear of breast cancer. We know that in the study, it was women 65 and over who were taking estrogen tablets plus testosterone tablets together who had the increased risk of heart attack, stroke, breast cancer, invasive breast cancer. And so there are other ways we can supply hormones without incurring that risk, right? But I decided to switch more to testosterone because it does the same thing as estrogen. It's converted to estrogen within the body. Um, but it's been around for 40 years and we have not seen an increased risk of breast cancer, stroke, heart attack in any of those women, whether by estrogen cream, whether by testosterone cream or testosterone pellets. And so I'm heavy on replacing testosterone also because women who come to me who are not having hot flashes but are just have no sex drive. Testosterone is the only thing we know that can replace sex drive hormonally. Estrogen, there are women who come to me who are already on estrogen. Their hot flashes are better, but they still just have no desire. And so those women need testosterone and it's safe. It does not interact with any of the meds that they have to take. It's like I said, been around for 40 years. I have over 100 women on testosterone, and so I've encountered a ton of people who have done well with the testosterone therapy. And when I combine testosterone, increased sex drive, with vaginal laser, increased sexual pleasure, women are much, much happier by the time they come for their follow-up appointments. So that's something I offer, helps with just women feeling normally, feeling beautiful, feeling good about themselves. I interviewed a patient of mine, and she said she had more happy feelings. She just felt just happier about life and about everything. I talked about this my patient already. And so my usual treatment profile for people is HRT plus FemiLift to kind of get them feeling good about themselves. Menopause also comes with hair loss. So I don't know if you ladies have had children, but when you're pregnant, estrogen levels are astronomical. Women have full hair. But once you're postpartum and your estrogen levels drop sharply, you're pulling chunks of hair out when you're in the shower. And so loss of estrogen is also associated with hair loss. A lot of women are getting thinner hair in the front or in the midpoint, in the crown of their heads. And so also what prompted me to look into hair restoration treatments. People are seeing dermatologists getting like topical treatments, PRP can be painful with kind of getting injections or traveling to Turkey to get a hair transplant. I have a few patients of mine who did that. So I got this machine called the TED. It's called Trans Epidermal Drug Delivery. Comes with a serum, and it's this device here. Let me see if I can play this video for you. This device here is sort of stimulating the hair follicles as I apply the hair serum. So getting the hair serum to go deeper into the hair follicle instead of applying topically, which can take months to get results. We're getting the hair serum deeper into the hair follicle, so women start to see results within 2 weeks, within a month. Let's see if I can have this video. Oh, can you hear anything?
On your hairline, or if you notice that you're losing hair every day, then keep on watching. You won't need a hair transplant for our Almated hair restoration treatment. This treatment does not need any needles, is pain-free, and will only last a few minutes. Almated is an ultrasound-based system that uses acoustic sound waves and air pressure to drive a hair growth serum deep into your scalp for better absorption. First, we apply a topical hair care formula on your scalp. This serum contains ingredients that will improve hair growth, scalp health, and hair follicle strength. Next, we drive the serum down to the dermis. You can expect to feel a warm sensation from the device and a ringing sound through the course of the treatment, but there is no pain involved. No needles, no discomfort, no trauma to the scalp. So we definitely recommend trying our treatment if hair loss is affecting your daily life and self-esteem. We can help you reclaim your youthful appearance and stop hair loss in its tracks.
All right, that's my little promotional video. So the sound waves from the TED machine open up the pores and allow the hair serum to get deeper to the root of the hair. It also contains algae, which anchors the hair so you don't get new growth pulled out. A lot of people actually tend to get their normal color back. So if they're getting some grays, they'll notice that the new growth is actually the dark or the brown or the red hair color that they used to have. So those are additional treatments that I offer. I tend to, cater to women who are just experiencing a decline in their life, a decline in their system, their sex life, hair loss. They're just feeling like they're deteriorating, and so the goal is to help them get their lives back. That's the end of my presentation. Any questions I can answer?
I don't think I have any other ones.
No.
That was very informative. Thank
Yeah,
you.
Thank you
for-
so much.
Good. I'm glad. Thank you for giving me your time.
Yeah.
Awesome. So yeah, if you have patients who they're complaining to you during their therapy about other symptoms, definitely send them my way. I'd be happy to do a consultation. Even if they don't have insurance or they have a different kind of insurance that we don't accept, we have a package that just allows them to have a consultation about it, and then they can see if it's a good option for them. And for women who cannot afford the, expensive treatments, I still offer the standard ones. So vaginal estrogen with pelvic floor PT, or the normal estrogen replacement with vaginal estrogen. Those are still my what I would call first line. And then women who are not doing good with those or just do not want to take something every day, then we offer the specialized stuff.
Perfect.
All right,
That's awesome.
thank you.
Thank you.
Thank you.